Okay, I'm going to get started. We were waiting to have people come into this virtual room, and I see that the numbers have now stabilized. I know we don't have too much time. I want to first thank you for joining us today. My name is Mark Hallerberg. I'm acting president of the Hertie School. I'm delighted to welcome so many of you here to this virtual event for such really an important and relevant discussion. We are pleased to be joined by Dr. Wieler from the Robert Koch Institute. Certainly no stranger to many of us who regularly see you indeed at German press conferences. Alongside Dr. Wieler, we are welcoming two additional experts, Dr. Nikola Biller-Andorno from the University of Zurich and Dr. Katharina Hauck from Imperial College London. My role today is simple. I have the pleasure of introducing Mujaheed Shaikh, a Hertie School professor of health governance, who is indeed today's host. He will then introduce the remaining speakers. Mujaheed joined our community just over 2 years ago. He has the professorship that is generously funded by the Robert Koch Stiftung as part of the Project Restart, a healthcare reform workshop, which is also simply known as Neustart. He previously taught and conducted research at the Vienna University of Economics and Business with a focus on efficiency and competition in health systems, health risk behavior, and healthcare issues in developing countries and in the global context. He has continued to work at the Hertie School, and in terms of his background, when he first started in 2019, we didn't know that the global health crisis would unfold and that his expertise and insight would be asked of like nothing before. He's one of our busiest faculty members anyway, but he's even busier given the current pandemic. We're very lucky to have him be part of our current faculty, and I'm delighted to have him here this morning. So Mujaheed, I turn the floor over to you.
Thank you very much, Mark. Good morning, everyone, and welcome to this webinar on vaccination strategies in Europe with a focus on Germany. It is a great pleasure to host this event with this stellar lineup of distinguished speakers that we have today that work extensively in public health and health economics. Our keynote speaker today is Professor Dr. Lothar Wieler. He needs no introduction. He is literally a household name at this time because of his role as the president of the Robert Koch Institute, which is the authority in Germany when it comes to public health. Professor Wieler is a specialist veterinarian in microbiology and was previously executive director of the Institute of Microbiology and Animal Diseases at Freie Universität in Berlin. He has also held and he continues to hold several prominent positions in academic committees worldwide. Since the start of the pandemic, he has been a trusted spokesperson on German and European television, and he provides up-to-the-minute details on the spread of the virus. We're very happy to have you here today. Our second speaker and guest for today is Professor Dr. Nikola Biller-Andorno, who directs the Institute of Biomedical Ethics and History of Medicine at the University of Zurich, which also serves as WHO Collaborating Center for Bioethics. She co-leads the PhD program, Biomedical Ethics and Law, and serves as Vice President of the Clinical Ethics Committee of the University Hospital Zurich. She is also a member of the Research Ethics Committee of the Federal Institute of Technology Zurich and is an expert advisor to the Swiss Medical Board. Thank you very much for being here today. Our final speaker and guest is Professor Dr. Katharina Hauck. She's a reader in health economics and deputy director of the Abdul Latif Jameel Institute for Disease and Emergency Analytics at the School of Public Health, Imperial College London. She specializes in the economics of infectious diseases and economic evaluation of complex public health interventions. She is a member of several senior expert advisory groups, including to the UK Cabinet Office. She and her team are modeling the health and economic impact of COVID-19 vaccine allocations and the health and economic benefits of pandemic preparedness for the G20 high-level independent panel. So these are our four experts, experts for today's webinar. It is our honor to have all three of you here today. But before we start our keynote address, I would like to take a couple of minutes to give you a quick snapshot of the developments since the start of the vaccination program. So I'm going to start with some controversial headlines that you will see that we all saw actually when we started the vaccination program in Germany. I hope you can see my slides. So we basically saw, Germany's strategy in the news all the time. In the beginning of January, it said, in Germany, vaccinations have always been political. Germany's vaccination rollout is not going as per plan. This kind of changed around March with a mixed picture where we did see international headlines saying that it's starting to bear fruit. But at the same time, we also saw again headlines like Germany loses COVID crown as vaccine campaign falters, and we're a laughing stock, as someone put it. However, something changed around April, and then the positive news started coming in. Germany's COVID vaccine campaigns started to show effect. Germany reaches a milestone of 30% of population vaccinated against COVID. Germany seeing virus cases go down and vaccinations go up. So clearly something changed in there. Something, if we call it strategy, something changed in that strategy. Around April, GPs started vaccinations as well. And that's when we saw these numbers going up directly. So that was a massive change that happened in how we were approaching vaccinations. Of course, we are always being compared with the UK and the US, but those countries also have a different strategy towards vaccinations. We all have heard the debates about vaccine nationalism and so on, but I won't get into that now. I'll leave that to our speakers later on. But countries within the EU face different challenges. So this is a report from the European Centre for Disease Prevention and Control on the kinds of challenges certain countries faced, which Germany did not face in some cases. So limited vaccine supply was faced by almost all EU countries, but Germany did not have to suspend or postpone vaccination campaign because of supply issues. There was a problem in terms of, or a challenge rather, in terms of strategies to limit discarding unused vaccines. Availability of vaccination sites was also to cover eligible population was also one of the challenges that Germany faced, but it didn't face challenges with respect to staffing shortages, with respect to availability of storage capacities like some other countries did. Of course, it faced some challenges in terms of communication, which we can see over here. Czech Republic was one country which faced that, Germany faced it, other EU countries not so much. But it did have systems in place to monitor vaccination programs and so on. So different countries facing different challenges. And of course, we will observe differences in strategies between these countries, given the challenges they face. If you go to the Robert Koch Institute website, which Professor Wieler will probably talk about later, and it's open and the document is out there. This was initially, the vaccination implementation strategy in 2 phases. You can go and check this document out, very informative, and it talks about the different phases that the vaccinations will happen in. Of course, there was a plan in place. We are seeing now that, of course, it's working, and we are in a different stage of the plan right now. But the big question after all of this is a question of equity as well. So different states within Germany have different vaccination rates. However, there are not massive differences between states in terms of the share of population vaccinated. But there are other issues cropping up, like headlines in Deutsche Welle, structural racism and vaccine access, the German data gap. We just do not collect data on certain issues and related to ethnicity and race. And of course, we don't know if there is any disparity related to that. On the one hand, Germany gives extra 1.8 billion euros for vaccine rollout to poor countries, but then we are also seeing in the news now, Germany resists calls to waive patents. Of course, there are other economic issues around that, but we do see these kinds of headlines. And just a couple of days ago, another headline came up in the New York Times, which said an opinion piece, which said Europe failed miserably with vaccines. Of course, it did. So given all this context, I think today's event is extremely necessary for all of us to discuss what's going on and to know what is going to happen in the future and to discuss future strategies. So we're very excited to have Dr. Wieler himself, who's really into this debate and knows a lot more about this. And we're really looking forward to your keynote address today, and of course to our other 2 speakers as well, who work in health economics and inequity issues and vaccinations. Thank you very much. I now hand it over to Professor Wieler.
Well, thanks indeed. Yep. So it's my pleasure to be here, and let me start by saying that the Robert Koch Institute's decisions are not based on headlines in newspapers, but on scientific evidence, to make this very clear. And if I have learned something during these 18 months, is that headlines in newspapers are more disruptive than they are helpful for any campaigning. The Robert Koch Institute, and then move forward to the, what, it doesn't work. We have been living now in these unprecedented times since nearly 17 months. And I have to say that Germany's pandemic response, I want to talk about Germany's pandemic response and our role as a National Public Health Institute. I want to briefly touch the vaccination campaign that has been touched already now, and also have a very brief outline on the impact of COVID-19 on our daily lives. So since the pandemic started, the public has clearly focused on the Robert Koch Institute because we are the National Public Health Institute. And I have to say that this has been challenging times. Clearly it is still, but it also brought a lot of opportunities. We were founded in 1891 by Robert Koch, many of you will know, a Nobel laureate, and he basically identified that pathogens are causing disease. And this is a breakthrough that we very much profiting from today. Our job basically is to protect and improve the health of the population in Germany. You know, I have to say that public health is both as fascinating as it is challenging, and there are so many factors, and therefore I'm happy that we have economists also in this particular role, because obviously economy and health are two sides of the same coin. What needs to be said is that we are a scientific independent institution. This is very important, but we value our collaboration with very external, national, as well as international partners. And particularly during this pandemic, this has been a huge learning curve. And I've been in video conferences basically every single day with all parts of the world. And we communicated and gained so much knowledge from each other from all parts of the world during this pandemic. This was very, very important. The legal mandate is to communicate with the expert scientific community, I have to say. So this is our legal mandate. Our legal mandate is not to communicate with the general population, but obviously it is hard to distinguish between this. And so we, since 17 months, are we absolutely communicating with the general public. So basically, although we do not have the resources for this particular task, we're just doing it. So how do we work during this pandemic? You have to understand that Germany is a highly federalized country. The responsibility for public health lies in the intermediate and local public health authorities in 16 federal states and nearly 400 counties. And it is also important to understand that all the health deliveries are the mandate of the federal states, not of the national state, only the federal states. So we are dedicated to prevention and control of an investigation of infectious diseases. And in particular, in addition to routine surveillance, our team conducts research on infectious disease pathogenesis, risk assessment, epidemiology, sentinel surveillance systems to support the federal government, but also the local and the intermediate public health authorities. We thus have 375 local health authorities, which we are basically supporting. So these are the three core capacities that are now interesting when it comes to the pandemic coordination: early detection of outbreaks, initial assessment of threat, and the ability to respond quickly and decisively, which basically is not in our mandate, but we are coordinating and managing this. So what virus basically are we dealing with? And there's a slide missing. Oh, no, this one here. Basically, we are dealing with a zoonosis. That's very important to understand. 60% of all emerging infectious diseases are zoonotic origin, and we all knew that a pandemic would come, but we never know, of course, when it will come. And here are some numbers about the impact of zoonotic diseases on the whole economy also. So these are very, very important infectious diseases which we have take much better care of. So when did this start, actually? It started on the 27th of January in Germany here. This was the first case that was detected by local health authorities. And as you see, this is the event that then afterwards were identified by what we call epidemic intelligence and contact tracing. And only by that we could find out that a particular patient from Wuhan brought this virus, at least as far as we know, for the first time ever to Germany. The virus is a so-called beta coronavirus, SARS-CoV-2, because we have some 10 years ago, we have had the, the luck to manage SARS-CoV-1 basically in a much more easy way, because this was not that contagious. And the reason is that that is, a cousin of SARS-CoV-1 or MERS-CoV.
Mm-hmm.
And it is a zoonotic virus, as I mentioned. The transmission occurs mostly via droplets and aerosols. And contact transmission via contaminated surfaces cannot be ruled out, but obviously transmission via contaminated food has not been detected. And this is not of particular importance. It's the aerosol and droplet infectious route. There have been various infectious change been published in between. And we now know, and this is a particular challenge, and this we didn't know from the beginning, that many of these patients transmit the virus already pre-symptomatic, so before they develop disease. And this, of course, is a huge challenge when it comes to contact tracing and particular outbreak detection and permitting transmission. Because if people do not feel sick, they are still walking around and still infecting others. This is a total difference to SARS-CoV-1, where we didn't know this fact from. Just a brief, but what kind of disease is it? It manifests in very differently ranging from asymptomatic infections to mild COVID to severe COVID, including death, as you know. The lethality in Germany, we have calculated, estimated it's 1.14, which is a huge lethality rate, of course. And what we know, what was unknown at the beginning of was long COVID. It's a syndrome that we have not full hand on, but it is obvious that at least 10% of all infected will develop long COVID, long-term effects, more than 28 days long. And this will have a huge impact on our society for the next years, perhaps. So this is something, it is unclear why some people recover quickly, others just after mild disease then succumb to disease and succumb to long COVID, which is a huge burden for our society, as I mentioned. Our strategy to contain this disease is based on 3 pillars. The containment. Here, our main aim is to continue and continues to be the containment of the virus, using all tools that we have. At the start, we had only a few tools, but these tools increased over time. Containing the virus means preventing new cases. And this is the most important, prevention. Yeah, everything behind prevention is just mitigation and protection, but prevention is the key area. And this is why the measures, the public health measures, are so effective. Preventing new cases. It's physical distancing, it's hand hygiene, and it's the use of masks. And it's ventilation, and this is very important because aerosols are playing a major role here. In addition, we also had the introduction of the innovative Corona warning app, which actually is hosted by the Robert Koch Institute. And of course, it is of utmost importance to break infection chain. And this is the duty of the local health authorities. Protection means, right from the start, the strategy aimed first and foremost at protecting the most vulnerable groups in our society. That is, and we knew this very early already in February, that is the particular old people. There's a clear association between age and risk of severe disease. Today, we are in a much better position thanks to the vaccine, which I talk about later. But obviously, again, infection, transmission, and prevention is still the most powerful tool. And this I want to remind you all the time, and until we have managed this deadly pandemic. Mitigation means this is an aspect of the strategy that focuses on mitigation the harsh effects of the pandemic. Now, right from the start, of course, Germany focused on increasing the ICU capacities because we knew that this is a disease that you need a lot of ICU capacity and ventilation in particular. So we monitored this in real time in a novel project, by the way, that was set up in April 2020. This includes hospitals and clinics from all over the country providing information about the ICU capacities. And we have been scaling this up and monitoring closely what kind of patients are there and what kind of therapy do they receive. In February this year only, because simply we didn't have enough evidence and enough data about this, we published our control COVID strategy. And I won't go into too much detail, but basically it is aiming minimizing the number of serious illness, long-term consequence and death caused by COVID-19, and to avoid overburdening of the health system in the long term. This strategy emphasizes the leading indicators for an escalating and de-escalating scenario, which the leading indicator for escalating being the 7-day incidence, because it's the most rapid changing one, while the leading indicator for de-escalation is the percentage of occupied ICU bed capacities due to COVID-19, because this is the slowest one. And you can, of course, get more insight into this because all these information is clearly published on our website. I'd like to touch on one topic which is of high importance, and I think you have seen this, or the questioning about data and the validity of data surveillance is very important, and I just listen here those most important ones. We have various others, but it's very complicated to tell this, but we have set them up, and this is the main issue here. For years and years ago, mainly focusing on influenza because this was the most obvious pandemic threat. But of course, it is also an airway disease, basically a pulmonary disease. All the tools are usable for our surveillance of cases of COVID-19. And these were very helpful, and we're reporting every single day since February 2020. We have a situation report where all the data are basically shown. We have been increasingly getting aware, and we're already working since March 2020. We know that viruses change their genomes, and with genome changing, there may be also a change in biological characteristics. And you know, yes, I think now everybody knows that SARS-CoV mutates naturally, and I have to say much faster than many of the even coronavirus experts predicted to be. But it's clear that if billions of people are infected, the ratio of mutation rises basically. And we invented the so-called German Electronic Sequence Hub at the Robert Koch Institute in January 2021 only, because before we didn't get funding for this. And this platform is used and is now one of the most successful tools worldwide, because since January already more than 150,000 genome sequences have been delivered. The truth is that in Germany many laboratories are able to sequence, but the data were basically lost before we imported the DASH, because now we can link this genomic data to the epidemiological data at the Robert Koch Institute, which we are calling the integrated molecular surveillance. And this is a tool and a concept that we are pushing worldwide now together with WHO, and I hope we can set up this also when it comes to G7 and G20 activities. This is a fantastic tool that we can also use, of course, for other pathogens, just to mention here. Having said this, how did we manage COVID so far? We have had 3 waves, as you know, and hopefully the 3rd wave is coming to an end. The first wave hit us in spring 2020. At that time, we had a rather unknown virus, but due to the public health measures, we very, very successfully and rapidly really destroyed this wave, basically. We had protective tools where the masses were not yet freely available. As I already mentioned, we focused on ICU capacities and the containment strategy. The 2nd wave hit us in autumn 2020, continued through winter 21. By that time, we have more knowledge about the virus and disease progression. We had protective public health measures, and a light to moderate lockdown was put in place. However, very often, and this is one clear messaging here, inconsistent implementation made matters much more complicated than they could have been. And the 3rd wave came in spring 2021. We had not yet brought down the 2nd wave, and therefore the level of the incidence level was too high. And therefore, we were dealing with a new virus, with a new wave, and this was particularly caused by a new variant of the SARS-CoV-2 virus, which is called B.1.1.7, because this was much more contagious, and so the transmission rate increased dramatically, up to 50%. Well, now coming to vaccinations. The vaccination campaign. We are definitely in what feels like a race toward the finish line now, but it's still a long time to go, I have to mention here. The first point I'd like to address is how well does the COVID-19 vaccine protect? And this is an issue that people outside of biology often do not understand. There's never 100% protection. This is very important to understand. So the effectiveness of the COVID-19 vaccine is between 80 and 90%, and this is highly effective, but it means that 10 to 20% of those vaccinated are not fully protected. Yeah? And it's both protected against symptomatic as well as asymptomatic infections. Second, I want to tell that people who tested PCR positive despite vaccination have a significant lower viral load and shorter viral shedding. And also data suggests that COVID-19 vaccination significantly reduces virus transmission, therefore. Fully vaccinated individuals are no longer expected to play a significant role. This is the most important and very, very good news. And we can be lucky that we have so fantastic scientists worldwide that brought these vaccines into living in a shorter time than a year. This has been briefly mentioned today. Basically, we're picking up pretty nicely and absolutely according to the plan that we set up in last autumn, I have to say. So now we have a vaccine coverage of roughly 42 million people. These are yesterday's numbers. And you see the secondary and first dose. The secondary doses will be in the next 4 weeks, we will have a huge amount of people having received the secondary dose, thus will be fully vaccinated. And here on the right slide, you see the vaccine coverage. Roughly 12% are currently of our whole population have a fully vaccination status, and 38% roughly have been vaccinated one time. And this has already been seen. There's differences between the coverages, full coverages, and this is about the strategy of the countries, of the federal states, as I mentioned. This is all the business responsibility of the federal states. It's not a national business. It's all in the hands of the federal state. And what you see from this picture is that the strategies each and every state did not depend on the amount of vaccines they received, but on the strategy whether they wanted to vaccinate more younger people or more people, both based on certain risk factors. Then it's a strategy of the federal countries. What we also did was a campaigning, of course. So what do you see here? It's about a person's willingness to vaccinate, and it shows that increasing willingness to vaccinate, the willingness increases with the effectiveness of a vaccine. We did surveys to find this out, and with the presence of pre-existing conditions and with increasing age, the willingness to vaccinate increases. Contact restrictions, and this is very important in the next slide, contact restrictions to prevent the third wave and overwhelming the ICU are more effective the earlier they start, and avoiding overburdening the healthcare system, particularly ICU capacities, will only succeed with cautious relaxations from May, June 2021, followed by successive increases in the degree of relaxation until late summer, when a large part of the population is vaccinated. So to say, nowadays, with this 12% of fully vaccinated, the impact of the vaccination on the whole pandemic is rather small. And this needs to be understood by everybody. We shouldn't and we mustn't relax too soon, otherwise we will have the risk of a fourth wave in autumn. So vaccination communication, briefly, you see we have various tools developed, and basically every other week we developing new tools and working together with various stakeholders to bring this into living and to communities. And of course, all these are in various languages in our country. And the last topic I just very, very briefly want to touch, the global fight against COVID-19. You know that currently as the situation in Europe and most of the global north is currently stabilizing. India has been hit by a deadly wave, and the variant B1617 is dominating. There are first clues that this variant might be more transmissible, but it's not yet evident. And clearly, the major problem we are facing during this pandemic is now vaccine inequity. This is for sure, and the global north has more access to vaccine, which drives the vaccination campaign for the entire population, while the global south still do not have enough vaccine for high-risk groups. And WHO estimates that this will only change at the end of 2022. There will be enough vaccination coverage in all countries worldwide. On an individual level, we have been impacted in our work life, family life, education, and socialization. And the measures in place, as well as direct effects of COVID-19, have affected the mental and physical health of many. And on a society level, we observe, of course, financial losses, overburdened healthcare systems, and social imbalance. And this holds true for Germany, of course. The pandemic has, in effect, only emphasized what problems we as a society already had, but they have now been seen, and this is a chance, to my understanding, that we perhaps work on this and will lead to a lesser health inequity in the future in Germany. Therefore, we need, of course, more surveillance data. And this is a map that we have recently published. It's the COVID-19 cases per 100,000 inhabitants, a very easy analysis, basically, just showing associations between these two factors. On the left side, we see the socioeconomic deprivation, and the quintile 5 has the highest level of socioeconomic deprivation. And on the right side, you see the number of COVID cases, and you see that this fits basically nicely. And this has been expected by all public health experts, but we have to work on this. And I hope that this will be a chance. So what have we learned? Human behavior and mobility is the driver of the pandemic. It's us humans that drive this pandemic 100%, because it's only transmitted from humans to humans. The pandemic has shown us how vulnerable even the best healthcare systems are under pressure. And social inequalities lead to marginalized groups bearing a large burden of the pandemic. To effectively handle a pandemic of this gravity, each one has to play their part well. For example, policymakers following science and implementing scientific advice, scientific advisors, evidence-based technical guidance, and good science communication is needed. Individuals, they have to accept and be compliant with the measures. And I want to make something clear. Everyone is in this together. This is the major outcome of this pandemic. And public health decision-making relies on real-time accurate surveillance. Future surveillance should therefore comprise very well integrated international systems. And this is a must to have this in the future. And finally, the health security should not be a privilege for a few, and this is something that I'm particularly fighting for. Governments all over the world must work towards a fairer and more equitable healthcare system. And with this, I end, and thank you for your attention.
Thank you very much for that very interesting talk, Dr. Wieler. I now pass it on to Professor Biller-Andorno.
Thanks a lot. I'll just share my slides. Can you see them?
Yes.
Great. Okay. Well, thanks. I'm delighted to be here and to offer some ethical considerations in our topic today. Just quickly. When we look at how countries are faring with a view to vaccinations, we see very different curves. We see Germany somewhere in the middle, above the EU average. We see Israel and the UK coming out on top, and other countries or even entire regions further to the bottom. But how do we determine performance? Is it simply the countries who've vaccinated most people at the highest speed, or who's best in class? As our organizers have rightly hinted at in the announcement already, the speed is great, but it's not all. You can see here, we must determine the fastest and most ethical way of distributing them. So what else is it that needs to be considered? Choosing a vaccine strategy is a difficult task, of course, and I will not claim to have any easy answers. It requires difficult choices. You have to make complex decisions. A lot of stuff is interrelated regarding pandemic management. You have to be timely, transparent. Your decisions have to be well legitimated. It has to be based on current evidence that's changing constantly. Decisions have to be open to continuous revision. But it's not only difficult choices, it's at times also hard choices, because you have to make trade-offs. And then this involves weighing ethical principles, balancing out responsibilities, while keeping in mind the overall goal in order to reach well-considered judgments. And what I want to do is to flag a few of those hard choices. It's as far as I can get in my 5 minutes. So what other ethical concerns can get in the way of our overall goal of, getting as many people vaccinated as quickly as possible? So the first one, obviously, is safety, based on the principle of do no harm and non-maleficence. I cannot take a stance here, but given the unprecedented speed and volume of vaccination, it's certainly safe to say that caution is in place. And I think that our drug approval authorities are well justified in carefully scrutinizing vaccine candidates before giving even preliminary approval. Otherwise, it's clear we might undermine our goals in the longer run, risk public trust, and possibly public health. So that's certainly a first item in our scale plan that may lead to reduced speed. The next item in that scale plan is respect for autonomy. That might also get in the way of pure speed. I think the easiest way to drive at speed is to tell people there's no shopping, no eating out, no visiting your relatives, no traveling for you unless you get vaccinated. But I think this strategy will come at a price. It may lead to distrust, it may lead to polarization, it may even get in the way of vaccination campaigns. So I think the way I would like to argue for is transparent information of citizens, as the Robert Koch Institute has done for the past year or so, or even before the pandemic, concerning other diseases. Space for individual risk judgments. It's not the same. The risk-benefit profiles of different vaccines are not the same for everyone. So I think we should respect choices. We should invest in vaccine literacy, which I think is a sustainable strategy that would also help us, be prepared for the next pandemic that may come along. And I would be wary of measures that focus on punishing, nudging, blaming, and shaming. And I think the immunization passports are an example for the fine line that needs to be found. I'm very happy to discuss this later. We've had a respective discussion in Switzerland on this. There are other examples, such as how should we deal with the presence of the anti-vax movements on social media? How heavily should we rely on censorship? So what are appropriate mechanisms that still respect autonomy while not getting in the way of speedy vaccination? And finally, the third principle that needs to come into the equation is fairness. We've had extensive discussions in Germany and other countries regarding fair access to vaccines. We've discussed who should be, in the priority group. How should the type of vaccine figure into these considerations, given their specific benefit-risk profiles? Should we aim at having a large part of the population served with first doses, or should we aim at a complete vaccination of people, including second doses? How can we ensure fair access of hard-to-reach groups, etc.? And I think it's very important to solve these issues well in order not to create social chasms. But I also think we need to be pragmatic and not complicate things too much. And I think an issue that I'd be curious to talk to Lothar Wieler about later on is maybe in the beginning, when we started out having, maybe a bit slow in getting people vaccinated, maybe we were trying to do too well on this fairness aspect, something that we might come back to in the discussion. And I think in our context here, I think, we can be kind of assured that, eventually there will be enough vaccine for everyone. So it's really a matter of months here. I'm personally much more concerned about this, and we already heard this in the previous talk alluded to. I think that's the much larger fairness issue. This picture that you see is a little dated, but I think it's not changed fundamentally. And even if we focus on Germany and Europe in our event today, I would like to invite us not to forget that fighting a pandemic requires a glance beyond national borders, and that small gestures might not be good enough, and that serious efforts are needed. So who's best in class? I think just aggressively going for bilateral deals is not a solution to the pandemic. And I think it's not so much about a race as about balancing out our responsibilities towards those who are closest to us and to those who happen to be further away. I also think it's about building resilient societies, not only with a view to the immune status, but also with a view to social cohesion. And I think that initiatives such as Publico a citizen engagement platform that my team has built with support from the Swiss National Science Foundation, the WHO, can help ensure people are on board when hard choices have to be made. The pandemic is catastrophic in many regards for many people, but it's also an opportunity to assure ourselves of our values and priorities to move forward as a global community. Thank you.
Thank you very much. I will now pass it on to Professor Hauck.
Thank you, and it's a pleasure to be here in this distinguished panel. Thanks for inviting me to this. So let me very briefly, that we have enough time for questions at the end, very briefly talk about the work of Imperial College and the Jameel Institute with respect to vaccine rollout in different countries. This work informs WHO SAGE, Immunization Committee, COVAX, and other institutions. Now, what we realized very early on really is that we need to look at the economic impact of alternative vaccination rollout strategies. So if you think about it, in a country that has no mitigation or control intervention implemented, the main benefit of vaccines, of course, is that it prevents deaths. But in a country which has some form of mitigation strategies implemented, such as closures of businesses that are non-essential to daily life and other restrictions, school closures and so forth, vaccines are in a way replacing these other control interventions as they are rolled out in preventing death. So as vaccine coverage increases, these other non-pharmaceutical interventions can be scaled down, and a greater speed in vaccination rollout means we can release these restrictions earlier rather than later with the associated economic and social benefits of this. So, so it is very important to investigate these two effects in a combined framework. And we have developed a set of models that allows us to estimate the integrated effects in an integrated fashion. So both the impact on death and the impact on the economy of alternative vaccine rollouts strategies. What we have done is that we looked at which economic sectors are necessary for economic protection and which sectors actually increase transmission more through the contacts that are made between workers and customers, and how much infection do then different economic sectors, workers, carry back into the community. And we are using many different data sources to estimate this integrated transmission model in order to see whether how opening certain economic sectors will and closing them will impact the overall transmission dynamics in a country. So what we are doing is essentially we run different scenarios. We look at how we can allocate when we allocate vaccines across working and non-working populations, and alternative assumptions on how mitigation measures are scaled back, investigate the impact on infections. So for example, we have evaluated the impact of the UK roadmap out of lockdown. So this is our process here in the UK of scaling back the non-pharmaceutical interventions between March and June this year. And what we have found, and these are very preliminary figures, is that under the roadmap, the GDP is around $48 billion. And when we compare that with the fully locked down strategies over the same time period, which would be $39 billion roughly, of course, these are very rough figures, then this is about a gain of $10 billion of the vaccine rollout versus keeping the lockdown restrictions in place that we had in the UK over the winter that were similar, I think, as in Germany. If you then compare just the GDP saving from the vaccination rollout against the costs of vaccinating the UK population, which has been estimated, again, it's very difficult, at around 12 billion, then we can see that along the GDP saving over the duration of the vaccine campaign are considerable, and that's even before we count any deaths. So what I want to say is really that very clearly vaccinations are highly cost-effective intervention, and probably once we count benefits beyond the period that the vaccinations are rolled out, they're even cost-saving. So, of course, now here in the UK, the situation is that we continue modeling this, continue looking at the impacts of increased transmission that may arise from the so-called Indian variant B.1.6.1.7.2. And we continue modeling the situation here in this country and in other countries as well. Thank you.
Thank you very much, Professor Hauck, for your insights as well. So I think we clearly know that vaccines not only save lives, but they also save the economy. We're open for questions and discussion now. I would like to give the opportunity first to both Professor Hauck and Professor Biller-Andorno if they have a question for Professor Wieler, and then we'll consider audience questions.
Just quickly a follow-up on providing access to vaccines for GPs. I think, I'm just remembering your comment, Professor Shaikh, in the beginning, that allowing GPs to actually administer vaccines was a true game changer in the German vaccine strategy. So maybe a question to Professor Wieler. Are you aware why did we wait so long until we let GPs actually get engaged in this?
Very clear answer. We didn't have enough vaccines. We have 50,000 practices. So if you deliver 1 million vaccination doses to 50,000 practices, it's simply not doable. And the practices, we warned all the practitioners, if we give them the vaccines, all people want to get vaccinated and they can't hold on to the prioritization. And this is exactly what's now going on. It's the lack, not enough vaccines, and prioritization, getting the handle of the practitioners. And now they have it. This is simply lobbyism. They knew it before the lobbyists knew that they couldn't handle it. We would have loved to give the vaccines out, but we need more vaccines to do it. It's very easy. It's absolutely as the ethical committee and the Leopoldina and the standing committee recommended last October. It's all exactly as we mentioned before. We know that we don't have enough vaccinations to give it to the practitioners. And the more we have, the more they will get involved. The more they will get involved also in companies and so on.
So
it's simply very easy strategical decision.
Thank you. Since we are running out of time, real quick, I have one question from the audience for Dr. Wieler as well. The question is, how will the lessons learned from COVID influence future work of the Robert Koch Institute in terms of identifying gaps, generating additional data? Have you got a shopping list of what needs to change within your surveillance system?
Well, we need more real-time data. The only real-time data is the DV register. And the reason for this is that the German health structure is highly diverse. And we try to get more real-time data so that we can judge more easily. If we had an electronic patient document where all the data are in, we could very, very easily get much more information. Just to let you know, with the decision that practitioners now vaccinate, the only information we get from practitioners is whether the person is less than 16 years old or older. That is the only information we're getting because of bureaucracy and lack of digitization. So an electronic patient record would be the fantastic thing. Think also about registers. We have so many registers. All the registers are so cost intensive. If you had an electronic patient record, you had much more information. This is a very, very, very important point, but we will see whether the German health system will oblige to this.
Thank you. We might have to stretch a bit over 11, a couple of minutes, because we have some really interesting questions coming up. A question for Professor Biller-Andorno. With close to 2 million dead in the US and EU versus 100,000 in China, which hasn't a liberal approach, no incentives, no punishments, Corona app only voluntary, that failed spectacularly. Why should we repeat the strategy for vaccination?
Why should we repeat the strategy for vaccination?
That's a question for Professor Biller-Andorno.
I have the same struggle in capturing the question.
Okay, well, it basically says, why should we repeat? I think it was about the approach you mentioned in terms of the liberal approach towards vaccinations, which fails spectacularly
The
apparently.
liberal approach.
Yeah, so why should we repeat this strategy?
I just think, it's also, I think it's not so easy to compare the Chinese situation and the European situation with the view to the dynamic the pandemic took. And I think we can't simply copy entire pandemic management strategies from one country to the other, but we really need to make sure it fits. And this is why I think, engaging with citizens, really listening to what they are willing to tolerate, also with a view to more long-term impact on society is so important. So I don't think we can take one, example from a country and just copy it to another.
Okay, thanks. Another question for Dr. Wieler. I'm curious regarding your thoughts on how to enshrine mechanisms to better prevent and contain future pandemics for the long term. How can we insulate such mechanisms from short-term political considerations and ensure consistent funding? This is something which I was wondering as well, because Germany really has poor funding for public health. It's so important to invest in public health, and we know that now.
Yeah, I'm happy that this question comes up. Yeah, we need more sustainable funding. It was all a public health crisis. If we see it very clearly, as I mentioned, the health system only does mitigation. It takes care of patients, but we could have, with all the public health measures, physical distancing, wearing masks and so on, we could have brought it down much more intensively. So sustainable understanding what public health really means. And this is something we are pushing with WHO and all countries. We have done this for years, and hopefully now it will work out. Public health is at the core, and this comes with a good governance in the country and a high education level, of course, of the people. So it's all about also social inequity. That is so, it is so known since years, but hopefully this gives a push towards simply doing more sustainable funding and setting up systems.
Absolutely, absolutely. You mentioned governance, and there's a quick question for you again. Is pandemic response an area that should be defederalized given the inconsistent implementation by the states?
This I didn't understand
So
acoustically.
Is pandemic response an area that should be defederalized given the inconsistent
Defederalized. Oh no, it's not about federalization or centralization. It's about quality of response and line of command. And you could have line of command even in a federalized country, but it needs to work. People need to work, and it should be trained in advance so that things are working. It doesn't depend on this. It depends on the quality of the people, competence, and the structures.
Right. So we understand that Dr. Wieler has to leave sharp at 11. So a quick last line, I think, from me, I conclude from your talk, the biggest takeaway is, and for everyone else that's listening, do not trust the headlines. Get in touch with the experts. Headlines are often misleading. They create controversy when there is none. So get in touch with the experts and get vaccinated. If Professor Wieler has to leave, we understand, but we are welcome. We'll be very happy if you can stay as well, and maybe take another question if you have the time, another minute or two. Yeah, maybe a quick question for you again. What is the RKI strategy for providing public health information accessible, particularly for marginalized groups? How does it tackle false information? Because I understand you mentioned in your talk that the RKI's responsibility is not communicating to the public.
Exactly. This is the task of the so-called Bundeszentrale für gesundheitliche Aufklärung. So it's a health promotion agency, also under the roof of the Ministry of Health. But we provide them with scientific evidence and information, but the campaigning is done by this institution. It's not by us.
Great. Thank you very much, Dr. Wieler, again for your time. Thank you.
Thank you very much. Very interesting. I'd like to be here longer, but what can I do? I have to move on. Take care, and please don't get too nervous too soon. Yeah, stay tuned so that we don't have a fourth wave. It's all only in our hands. We have it in our hands. Thank you so much. Bye-bye.
Thank you. We have a couple of other questions that maybe the other respondents or other Professor Hauck or Professor Biller-Andorno would like to jump in. Maybe for Professor Hauck, you mentioned that vaccines actually went on to save about $10 billion worldwide, right? Do you have any information on how that played out by different countries? So which countries were with the largest savings, because countries clearly have different demographics and the effectiveness of vaccines or cost effectiveness of vaccines differs per country, I believe, right? So do you have any additional data or information on that?
Yeah, so the $10 billion, 10 billion pound actually figure is for the UK, and just specifically comparing the UK roadmap out of lockdown, which is a planned gradual easing of restrictions, compared against a situation where we would have stuck to the lockdown until June, when we hope this our restrictions can be lifted. So the 10 billion is just that estimate for the UK. Now, for other countries, I think we have not much evidence yet. And of course, as I said, it's very important to see how actually countries are mitigating and whether they are at all mitigating the pandemic. Because if a country does not impose any lockdowns, then they will have a reduction in their GDP due to voluntary reduction in economic exchange. So people will consume less because they are feared they get infected if they go to the shops, or even workers may reduce the number of hours that they work. And we can see that played out in India, where it's not actually their own infection, but the infection of their family members, which keeps a large group of the workforce at the moment out away from their workplaces because they're just trying to find care. So I think these economic effects are in an unmitigated pandemic that are very difficult to estimate. But for mitigated pandemics in countries where there are restrictions imposed, as we roll out the vaccine, we can scale back these NPIs earlier rather than later, and that's associated with an economic gain that we can estimate, albeit very imperfectly.
Thank you very much. So we've run out of time now, but this was a very, very interesting discussion, great input from all the three panelists. We were very lucky to have all of you here. Maybe a final concluding remark would be, we always see in the headlines that we're being compared to the US and the UK and how, we're doing in relation to these countries. Germany has also done much better compared to other bigger countries or other countries like Australia, New Zealand, and Taiwan, which did very well, just like Germany in the beginning. But in terms of vaccination rates, we're still far ahead these countries. So the picture is not all that grim. We're getting there. And as Dr. Wieler said, we're all in this together. So stick around and keep listening to the experts. Thank you very much, everyone. Have a very nice week.
Thank you. It was a pleasure.
Thank you.
Thank you.